Use your eyes to make diagnosis. How? Watch this video with Dr. Kawaja. Measles. Koplik spots. Small white spots in buccal mucosa. So don't forget to see inside of mouth if you are suspecting measles. Parkinson disease. Pill rolling tremor. Resting tremor that appears as person is rolling a pill between their thumb and index finger. Raynauds disease. Stenosis, discoloration of fingers because blood vessels narrow when exposed to cold or feeling stressed. Rheumatoid arthritis. In a swan neck deformity, the proximal interphalangeal joint is hyperextended with flexion at the distal interphalangeal joint. In a boutonniere deformity, there is flexion of proximal interphalangeal joint with hyperextension of the distal interphalangeal joint. Addison disease. Bronze-tinged skin. Caused by excess ACTH which act on melanocytes to produce melanin. Down syndrome. Simian crease. Single transverse palmar crease. So in Parkinson, Raynauds, rheumatoid, Addison and Down, don't forget to go down to hands to examine them. Tetany. Chovstek sign. Twitching of facial muscles in response to tapping over facial nerve. Trousseau sign. Carpopedal spasm induced by pressure applied to arm by an inflated sphygmomanometer cuff. Meningitis. Brudzinski sign is positive when passive forward flexion of neck causes the patient to involuntarily raises his knees and hips in flexion. Kernig sign is positive when lying with hip and knee flexed, extension of leg passively causes pain. Hepatitis. Icteric scara. Yellow discoloration of scara. I know you already know that we always examine scara in sunlight. Typhoid. Rose spots. Small red spots on abdomen and chest. Acute pancreatitis. Cullen sign is a bluish discoloration of umbilical area while Gray-Turner sign is bluish discoloration of left flank associated with acute hemorrhagic pancreatitis. Intussusception. Sausage-shaped mass. You know in intussusception proximal segment of intestine telescope into distal segment. Bad manners intestine, please stay in your own zone. Pyloric stenosis. Olive-shaped mass. Enlarged and thickened pylorus muscles. So in intussusception, acute pancreatitis and pyloric stenosis. See the belly. Thalassemia. Chipmunk face. Due to overexpansion of bone marrow to help the body counteract anemia present in thalassemia. Acromegaly. Large face and hands. Protruding lower jaw and brow bone, and enlarged nose and thickened lips. Graves' disease. Exophthalmos. Immune system attacks the muscles and fatty tissue behind and around the eyes, causing them to become inflamed. Thus results in exophthalmos. Systemic lupus erythematosus. Butterfly rash. It is an immune response after exposure to UV light. Leprosy. Leonine face. Widespread facial distribution of lesions leading to coarsening of facial features. Dropping of eyelid is ptosis. It is bilateral in myasthenia gravis and myotonic muscle dystrophy. And unilateral in Horner syndrome. So it is either thalassemia, acromegaly, Graves' disease, systemic lupus erythematosus, leprosy, or ptosis. Face tells each and everything. Obesity, prediabetes. Acanthosis nigricans is a condition that causes areas of dark thick velvety skin in body folds and creases like armpit, groin and neck. Tetanus. Rhizus sardonicus. Fixed sarcastic grimace and anxious expression caused by spasm of masseter and other facial muscles. Opisthotonos. Spasm of back muscles causing backward arching of head, neck, and spine. Deep vein thrombosis. If dorsiflexion of foot cause pain in calf muscle means positive Hohmann sign. Croup. Steeple sign, also called wine bottle sign or inverted V sign, referred to tapering of upper trachea on frontal chest X-ray reminiscent of church steeple. Acute epiglottitis. Thumb sign is a rounded thickening of epiglottic shadow on lateral neck X-ray, giving it an appearance of thumb. Liver cirrhosis. Spider angioma. Spider nevus occur when body have excess estrogen. In liver cirrhosis, estrogen cannot metabolize by liver, results in spider angiomas. Pernicious anemia. Beefy red tongue. Occur due to deficiency of vitamin B12. Kawasaki disease. Strawberry tongue. Red tongue with small seeds. The tiny thread-like projections on the tongue shed or slough off, and the mushroom-shaped projections remain, which form the seeds of the strawberry. Cushing disease. Buffalo hump. Caused by excess fat deposition in neck. Chronic obstructive pulmonary disease. Barrel chest. Lungs are chronically overinflated with air. This gives chest a pronounced barrel shape. This ends our today's lecture with lesson. Stop smoking if you don't want to have barrel chest. If you want to purchase Dr. Kawaja publications. Review of ENT by Dr. Kawaja Ages and Review of Robin Morphologies by Dr. Kawaja Ages. Contact on these numbers.